Now we have another startup, Medfly, who is involved in a teleconsultation application connecting doctors and patients at the comfort of their homes. To make their pitch, I invite their co-founder Shreya Chandrakar, IITBHU batch of 2018, Department of Electrical Engineering. Over to you, Shreya.
Thank you very much, Dirghayu. Is my screen visible?
Yep, perfect.
Okay, thanks a lot.
Hello.
So current teleconsultation apps don't provide the level of flexibility or control that doctors need over their consultations. They have to compete with other doctors for visibility based on customer feedbacks, and the user experience can be challenging, especially for elderly and rural populations, which overall leads to a compromised patient loyalty. Doctors also resort to video calling apps like WhatsApp and Zoom, but since they are mostly informal in nature, they go unpaid a lot of times, resulting in reduced earnings for the doctor. Plus, there's the hassle of managing multiple apps for different purposes. And there comes Medfly for verified doctors, where a doctor can create appointment and share the meeting link with the patient, and patient can book appointment using doctor's unique booking page. Through Medfly, doctors will experience increased paid consultations, improved patient loyalty. There won't be any rating-based competition amongst them, and they can enjoy benefits of PWA since they don't have to necessarily download apps anymore. To fulfill our mission of creating a well-integrated, seamless teleconsultation platform for all, we'll eventually be partnering with diagnostic labs, pharmacies, medical device companies, and other partners to give them a seamless experience. We are different from our competitors in the way that we give more control and flexibility over teleconsultations to the doctor. We offer a one-stop teleconsultation experience, and we are going to adopt a very vertically focused approach. So currently we have developed our MVP available at the link given. And based on the feedback we received and interviews we conducted with like 100 plus doctors, we realized that we need to have a depth first approach, focusing on each specialization separately and also focus on patient ease. So we have finalized our initial target to be homeopathy, Ayurvedic, dermatologists, physiotherapists, and general medicine practitioners from tier 1 and tier 2 cities, primarily because they comparatively have easier adaptation to teleconsultation compared to other medical streams. Plus, there is huge untapped market potential that we can tap. So for our early adopters, we are going to give them medicine delivery for homeopathy and Ayurvedic doctors. And for physiotherapists, we will have video sharing and repository feature. Then we'll move on to other specializations by integrating medical devices in the app for improved diagnosis and eventually partnering with labs for DICOM medical report sharing. Our ultimate vision is to penetrate the rural markets as well, who need us the most, by providing very simple user experience with a multilingual app and features like offline kiosks for patient assistance. We plan to collect revenue from subscription fee as well as commission on consultation fee. And our secondary revenue stream would be commissions from our partners in future. We are a 2-member team from IITBHU and IIT Delhi 2018 batch. And we are seeking mentorship as well as funding of rupees 25 lakh for product development and customer acquisition. Thank you very much.
Thanks, Shreya. Now I would like to request Mr. Pratish Gupta to share his thoughts and the feedback on Shreya's pitch and ideas.
Right. Hey, great presentation. I think it's a problem which exists and needs to be solved for, especially from the, really like the idea of focused care, right? And targeting segments which are currently not tapped that fully, right?
Yeah.
So that's a great thing. What I would suggest you to do specifically is, do a very small target a very small cohort of doctors first and very small cohort of patients, right? And, create 100 or maybe, 500 paying customers only, right? And solve for the problems for them. Because the challenge that, I foresee that you will face is the competition from some of the bigger players, right?
Yeah.
They already have a template which they can replicate to other, other streams, right? For Practo, it's much easier to go to dermatology and, for Cult to go to other dermatology and, Ayurvedic practices. And some of them are already starting to do that, right? And for a consumer, it's much easier to switch to already being part of the Cult ecosystem, for example, or Practo ecosystem. It's much easier for me to continue taking up their services, right? So from that perspective, I'll have much more trust factor in them than in a new platform which is up and coming, right?
Yeah.
So I would really suggest that, instead of opening up yourself to, let's say, 10 practices that you just, or 5 practices that you mentioned, pick up one of them, really prove your value, right, to customer and the doctor. That's one thing. Second thing you mentioned about, B2B integrations. The challenge with B2B integrations generally is, you need to hit a scale for you to be relevant when it comes, for an enterprise to pair
Yeah.
up with you, right?
Yes.
So how do you really, or your value proposition needs to be so differentiated that you can solve for it, right? So you need to figure out either of the two things, right? And at the same time, your tech stack or technology, technology architecture needs to be so as in robust and modular from the very beginning, that you can actually create those APIs and have opened up those APIs. You're ready for integrations, because some of the challenges that technology companies face later on is
Yeah.
their APIs are generally not ready, right? And hence they can't integrate with other companies, right? So create a technology stack from the very beginning, which is modular and at the same time integrable with other enterprises. So I think just keep those three things focused, and I think in focus, and you'll be, I think, good from the beginning.
Yeah, that's really helpful. So, actually, actually this was the question that I wanted to ask you as well. So, thanks very much. And about focusing on one like practice that you said. So, our initial target, we had thought of it like the first target would be probably homeopathy, and since medicine delivery of homeopathy is very key problem for them, especially when it's remote. So that's something that the first probably B2B integration that we plan to have would be with courier partner, with a delivery partner for home to home pickups and drops. So yes, I think your whatever your suggestions were makes really a lot of sense, and that's really helpful. Thank you.